how to prevent and reverse heart disease. Heart disease is number one or number two killer of human beings, depending upon the year. Sometimes cancer is number one, sometimes heart disease is number one. And heart disease is a disease of. I have done more than 10,000 angiograms, and almost every week we are surprised to find totally normal arteries in someone who's 80 years of age or someone who's 75 years of age, while it doesn't surprise us when we see people who are in their early 40s or 50s having very bad blockages. There are certain areas of the world where heart disease is almost non-existent. Certain parts of Greece, certain areas of Japan, Central Africa. There's a belt in northern Mexico where heart disease is almost non-existent. And epidemiologists, people who study natural history of diseases and their relationship to societies, their food and culture, firmly believe that it is the lifestyle that leads to atherosclerosis. It is not the aging of arteries. It is not something which is inevitable, that as you get older, you're going to develop blockages in the heart. That's why the title of the talk is Preventing and Reversing Heart Disease, because if we follow a 5-point program, which I'm going to talk about, I think we may not be able to cure it, but I think we can really make significant strides in preventing or reversing heart disease. This is a 5-point program I have used on tens of thousands of patients in a lifetime of practice for last 25 years. There are many programs like very aggressive dietary program, very aggressive medical program, but I feel that in life, it's very difficult to follow extremes of diet, extremes of exercise, extremes of anything. So if we do things in moderation and follow these 5 principles, we can have great luck. The word luck I use because there's nothing definite in our human lives. We can do everything perfectly and still end in failure. But that should not prevent us from doing things which have a higher chances of success. I will give you an example. Anesthesiologist who's still working. Around 10 years back, he came to my office, rather his wife called me that I'm sending my husband to the office because for last 1 week, he has been having chest pain. And he doesn't want to go because he thinks it's just some acid reflux or stress that's causing this chest pain. I saw the physician. He was very nervous and he sort of kept on denying. He says, just my wife is just anxious and that's why she sent me here, but I really don't have any problem. Finally, I persuaded him to get some blood tests done, get a stress test done, and we did a CT of the heart and measured the calcium in his arteries. His cholesterol level, I still remember, was 205. His bad cholesterol, we call LDL, was 120. His HDL, which is a good cholesterol, was 35. And his triglycerides were 200. Normal is less than 150. We did a calcium score on him. His calcium score was 200, and he had a lot of calcium in the widowmaker artery or the left anterior descending artery. So after much discussion, the anesthesiologist agreed to have an angiogram done. I did his angiogram, and he had a 70% blockage in the artery on the front side, the mid portion of the left anterior descending artery. In most of the cases, people get a stent when you have 70% or higher blockage. And he was having some symptoms, but not severely symptomatic. With a lot of deliberation, and he was also agreeable to trying intensive medical management and dietary management, we decided to treat him with dietary therapy and lifestyle modification and medications. And I talked to him about the 5 principles. And we will go over these 5 principles, and I'll tell you the result in the end. The number 1 principle for reversal of heart disease is good diet. And we'll talk about that. Number 2 is exercise therapy. I call it therapy because it is not just exercise, but it's a therapy for the inflammation in your arteries. Number 3 is sleep. Importance of sleep we'll talk about is paramount in treatment and reversal of heart disease. Number 4 is medications. I am not one of those doctors who's going to say that just diet and exercise is going to reverse everything. I have seen too many people. It's very, very difficult to follow diet and exercise. We need addition of medications also. And the last but not the least is social support, avoidance of loneliness, being happy, avoiding stress and anger, because all these cause inflammation of your arteries. So if we follow these 5 principles, we can really reverse or prevent heart disease. So let's start with the diet. And I will give you the advice which I gave it to my friend and I give it to my patients in the clinic. First of all, diet has to be personalized. Every human being is different. Every human being grows up in a different cultural environment. And the cultural environment or the society in which you grow up has a big role in what type of diet is going to be good for you or what type of bad diet you have been eating. There is different diet for different people. Asians, they grow up eating something different. For them, the diet is different. Someone who's in a rural Midwest area, they've grown up eating meat and potatoes. The diet is very different. For someone who grew up in Beverly Hills, the diet is very different. Someone in downtown Rock Island, the diet is very different. So before we even talk about diet, we cannot generalize. You have to see where the patient is from. And then based on the socioeconomic, educational level of the patient, you have to modify that. So for this anesthesiologist, things were easier because he understood many of the concepts. The diet was really not very bad, what he was consuming. He could afford the different types of food we talked about. And that is also very important for someone whose economic level is not high and you tell them that you eat sushi grade tuna every day. That is not going to work. So one has to keep that in mind. So there are certain foods which we should try to avoid in diet. Dairy is number 1. I think avoiding saturated fats that come in cream, full fat milk, cheese, butter is not good for the heart. What I recommend to people is that if you like butter, just have a very, very small amount of it. Instead of having a spoon of butter on your toast every morning, You can put some olive oil and add like a speck of butter to it for the flavor. Another principle of diet, which is very important, is that you should not kill your taste. Because if you kill your taste, you will not follow the diet. The second important things to avoid in dietary management of atherosclerosis is red meat. Now, for certain people, meat is lifestyle. So what I tell them is, instead of having a pound or half a pound of steak every night, have once a week grass-fed steak and just have a small piece of it. Fill your stomach with salad, and then just for taste, have just half ounce, 1 ounce of red meat. But avoiding red meat and other types of processed meats is extremely bad. Things like hot dogs, things like hamburgers. You have to cut it out of your diet. If you feel like having a hamburger, I tell my patients, take a bite and throw away the hamburger. Just one bite. You need to have the discipline to do that. But if you are on a diet of hamburgers once a day, that is not going to do it. The third thing we need to avoid is sugar. Sugar is as bad as fat. Sugar, biggest problem I see in my patients is patients drinking sugar-rich sodas. As soon as you take that out of your diet, a lot of my patients lose 5 to 6 pounds immediately, within a couple of months. And I tell them, just drink water. The diet sodas are not good at all. They are equally bad as the sugar-containing regular sodas. Because when you take a Diet Coke or Diet Pepsi, first of all, it's very acidic. It disturbs the lining of your stomach, it destroys your teeth, and it destroys the bacteria in your intestine. And more research is coming out that the intestinal bacteria are very important for good health. The other thing that happens is, when you have the 0-calorie drinks, they make you hungry. Insulin is released because they stimulate release of insulin, and insulin goes to the brain, and this is a messenger to the brain to eat some sugar. So you may have a diet soda, but you get hungry, then you go and have a piece of cake or ice cream. That doesn't help. Important types of food to have in a good, healthy diet are green vegetables. I recommend to all my patients to have a green vegetable at breakfast, lunch, and dinner, and some snacks. I tell them to pack some green vegetables with them and take them to work and eat them when they're hungry. There are different types of green vegetables. You can see what you like. Sometimes people find the green vegetables a little bit not to their taste, or have a different, may find them to be a little bitter. So if you boil any green vegetable in water for 4 to 5 minutes, a lot of the bitterness goes away. And then you can add it to whatever food you're adding. So that's a little pointer, but green vegetables are very important. The second important food element is fruits like berries, every type of berry, raspberry, cherries, strawberry, blueberries. They are excellent. And I tell my patients to add it to as many servings as they can make smoothies out of it. And you don't need to buy fresh berries. The frozen berries are very good, and they are not that expensive. You can go to Sam's or Costco and buy a big pack of that and add it to different meals. The third part is oil. I recommend to cut down oil as much as they can. Instead of oil, use like balsamic vinegar. And once you get a taste of balsamic vinegar, you won't add oil to dressings and different things. Try to have a good pan, which is non-stick, so you can add just a little bit of oil to prepare your meals. And the oil, extra virgin olive oil, buy good quality olive oil. I think that is good. Avocado oil is good, but try to avoid canola, safflower, different vegetable oils. They are not good. The fourth element of good eating is moderation. We eat too much, and number of studies have shown that people who eat less live longer. There was very nice experiment done in rats several years back. They fed them 20% less of what was their daily requirement. And those rats who ate 20% less lived 20% more. The other element of the diet is timing of what you eat. I want you to finish your dinner before 6 p.m. Then have several hours where you should go for a walk or exercise or let the food digest. The smallest meal of the day should be dinner. Don't eat anything once you are done with your dinner. No late evening snacks and things like that. Then don't eat anything till 10 a.m. next day. Several studies now have shown that the insulin levels in the body go down if you fast for 14 to 16 hours. There are several benefits to that. First of all, if you cut down the time you eat, I get most of my patients to having just 2 meals a day instead of 3. So already you have cut down 33% of your caloric intake if you have 2 meals. So if you have a meal at around 10 o'clock and you have dinner at 6 and you can have some vegetables for snack at 1 or 2 o'clock, you will end up eating less. Initially, you may get hungry, but if you do it for 30 days, your hunger receptors are sort of downgraded, so you won't feel hungry. The other important concept in dietary management is compliance. In medicine, very important thing is that you follow a plan. Many a times doctors see the patient, then they tell them follow up in 3 months. Patients come back in 3 months and they don't follow the plan. If doctors see the patient on a regular basis, there's a more chance that the dietary plan they have set up for the patient will be fully complied with. That is where Trinity's Nutrition and Dietary Center is very important for the patients. I would highly recommend to all the patients that they should join it, because there'll be someone who will make you follow the plan on a regular basis. It is not going to be your doctor. Doctors are too busy. They won't be seeing you on a weekly basis. You need to be seen initially, frequently, so that you follow the plan. If a plan is written out to you and you see the patient after 2 to 3 months, there's only 20% chance that people follow, at least for the first 90 days. And there's a lot of scientific evidence that it takes 90 days to build up a habit. They have done studies in smokers. So if people don't smoke for 90 days, there's almost 90% chance they won't smoke again. If you keep on exercising routinely for 90 days at a particular time of the day, it'll become like clockwork for you. If you follow a particular diet for 90 days, it'll become clockwork for you. And after that, there's almost 70% chance you will follow that. So these are certain very important things that lead to dietary compliance. And I will repeat certain things. First of all is moderation. Second is mostly plant-based diet, but you don't need to be vegan. You don't need to be vegetarian. If you can have 80 to 85% of your component of the meal as plant-based and 15 to 20% you have good quality meat, high quality salmon, high quality grass-fed beef, or high quality chicken or fish, that's okay. Because the diet has to be something that you enjoy eating also. And if you tell a 50-year-old person who has been eating steak all his life and enjoys it, that from tomorrow you turn vegetarian, there's only 10 to 20% chance that this person will follow your advice. It's important, and all of us who have children realize that uh, only give advice which can be followed. Just don't give advice uh, which is difficult to execute. Don't tell your child to climb Mount Everest. Just a small hill is good enough. So that is very important. Um, Third is a program like Trinity's Nutrition Center, very important for compliance. Um, Otherwise, you can have one of your family members, but it's very difficult for family members to make the other family member follow dietary advice. It has led to many broken relationships. I won't encourage that. Let Trinity's Dietary Center manage your dietary compliance. Don't put it on your spouse. You may end in divorce. So don't do that. So that's about diet. Um, the second point is exercise. Exercise is extremely important for several reasons. First of all, it decreases inflammation in your arteries. So when someone has a heart attack or starts having chest pain, it is the inflammation in the arteries that's causing that. So if you exercise on a regular basis, you decrease the inflammation. This famous nurses study where tens of thousands of nurses were studied, and nurses who exercised for 30 minutes, 5 days a week, had 30% less chance of having a heart attack or stroke, which is a good deal. The second thing is when you exercise, your endorphin levels go up. So you get happier, you have less stress. So if you're happy, uh, you're more likely to follow a good diet. If you are stressed, if you are unhappy, you are angry, uh, you're going to go to comfort food. What is comfort food? In our culture, comfort food is having a hamburger. Comfort food is drinking a six-pack of beer. Comfort food is having two hamburgers or ice cream or something like that. So exercise helps you feel happier, less stressed. Um, the third thing is uh, people with heart disease, if they get sedentary, they start losing muscle mass. And after the age of 50, normally we start losing muscle mass. So if you exercise, and I recommend both aerobic as well as some weight training for my patients, because it is not just getting your heart rate up a little bit that helps endorphin release, but you need to have a certain amount of muscle mass to feel good. So exercise will help you there, and it'll lead to better compliance with that. You can exercise in the morning, you can exercise in the evening, or during the day. If you feel you're very busy, I tell people to break down their exercise into 10-minute cycles 3 times a day. That helps many people. They feel less stress. At work also, they take a 10-minute break, sometimes go to their offices, do little yoga in their offices. You can do some sit-ups, you can do some push-ups, very simple things you can do in your office or at home, or just simply walk. If these things are difficult for you, just walk around in the house, or when the weather is good, walk outside. There is this whole concept of garden and tree therapy. If you have a chance during the summer, spring, or fall, we have many beautiful gardens and state parks in our area. Go to them, they are even more relaxing. And actually, there are studies that show if you exercise in a park or in the midst of trees, it is more beneficial in decreasing your heart rate and blood pressure than exercising in a gym or at home. The third important point is sleep. We don't pay much attention to sleep. Very few doctors talk about sleep, but sleep is something very important. It's just common sense. We spend 1/3 of our life sleeping, and if we don't do it well, it has a huge impact on the other 2/3 of our life. Good sleep is essential to improve your blood pressure, which has an adverse effect on your cardiac health. It has an adverse effect as far as stroke is concerned. High blood pressure damages your kidneys. So good 7 to 8 hours of sleep is very important. And I will give you a few guidelines that can help you sleep better. Number one, not more than 1 cup of coffee a day. And if you have to have a cup of coffee, have it in the morning, but absolutely no cup of coffee in the afternoon or in the evening. Even 1 cup of caffeine actually has a harmful effect on your sleep, and number of studies have been done. So cut down on caffeine as much as you can, but limit it to not more than 1 cup of coffee, and that you should have in the morning. But no tea, caffeinated products in the afternoon or in the evening. The second important thing with sleep is if you take a warm shower before you go to bed, that helps you sleep. And there are many cultures, including Japan, which is a cultural thing. People take a hot shower before they go to bed, and now several studies have shown that it improves the quality of sleep. The third important thing is no exposure to white and blue light. The light that comes from your phone, the light that comes from your computer, the light that comes from the television is not good for sleep. So make it a habit for next 90 days. Don't look at your phone for at least 1 hour before you go to bed, or don't watch television. Anyway, there's so much disturbing things on television. If you watch CNN, you'll be upset at certain things. If you watch Fox, certain people get upset at that. So best thing is not to watch any television, at least for an hour before you go to bed. What I suggest to my patients is read a book. If you don't like reading, listen to some music. The third thing is if you don't want to read or listen to music, just close your eyes and pray, meditate for 10 to 15 minutes. Think of some good memories. Be grateful to the good Lord for the good day you had. There's always plenty of things to be grateful. Don't think about negative things before you go to bed. Fourth thing is make sure you have a good mattress. It's very important. You're going to spend 1/3 of your life lying on that mattress. It's worth investing few extra $100 to have a good mattress. The fifth thing is that never go to bed angry. If you are angry about certain things that happened in your life that day, just resolve it in your mind and go to bed with positive thoughts. I think these 4 or 5 things will help you get a good sleep, but understanding the importance of sleep is extremely important. If you understand that this is a problem, it'll help you. If you have a good night's sleep, you'll be more disciplined next day in what you eat and your exercise routine. So this is all interlinked. Number 4 is medications. There are certain medications, if you have heart disease, if you have blockages already, you had bypass surgery, you have stent, I highly recommend that you take your statins. Statins are wonder drugs. These drugs have cut down the risk of heart attacks, stroke by 30 to 50%. Keep on doing everything, but make sure you take your aspirin, you take your statins, make sure your blood pressure is around 120 on the upper range and 80 in the lower range. These are very important things. If you have diabetes, make sure your hemoglobin A1C is around 7. Know your numbers. I tell patients, know your ABCs. A is hemoglobin A1C, B is your blood pressure, C is your cholesterol. If you have heart disease, our goal for bad cholesterol is 55. It has come down from 100 to 70 to now 55. That is the number you want to achieve. If you know the number, you discuss with your doctor every time you go. If you have stents, if you had bypass surgery, that doctor, am I at my goal of 55 or not? And what do I have to do? So diet plus good medications will really help you achieve that goal. Be compliant. If cost is an issue or any other side effects are an issue, write them down, discuss with your doctors. Many of the side effects of statins are related to what you read in the paper. It gets in your mind. You read on internet. There was a big study done. They gave placebo and statins to half of the people, and they didn't tell them who's getting what. The side effects were equal in both the groups. So people who thought they are getting statins, but they were just getting sugar pills, had equal amount of muscle aches and pains. So a lot of it is what we think. If we think we are going to get that side effect, you will surely get it. Now, the last but not the least is social support. We are social animals. We live in a society where helping each other helps each other. What I mean is that if you create a caring environment around yourself, you will be able to achieve the first 4 goals very well. And that caring environment will come if we make an effort to create a caring society. If you feel that Mrs. Smith, your neighbor, just recently had a heart attack, she's 80 years of age, and there is no one else to take care of her. Her children are far away, or she doesn't have any children, and she comes back from the hospital after a heart attack. As a good neighbor, if you approach her and just chat with her for 5-10 minutes every day, ask her if you can do something for her, you will improve her chances of living by around 20 to 25%. These simple things. And in this world, I firmly believe that reciprocity helps, and it works. When you do good things for others, others will do good things for you. And in the matter of treatment and prevention and reversal of heart disease, this is extremely important. We need to create a society where people are not lonely. They have good support. And I have seen many families where children are taking care of their parents, or parents are taking care of their children. There are friends who are taking care of each other. Those people live longer. They have less risk of recurrent heart attacks. And recognizing that and helping each other in our small social groups or in our surroundings, in our neighborhoods, is very important. Because even if you help someone, you're helping yourself, because it'll improve your heart health. So these are the 5 things. If we follow, there's a very good chance that we can reverse or prevent heart disease. Now, going back to the example of my friend, anesthesiologist, he followed the diet very strictly. He actually created different types of menus and became like an expert chef, got interested in the science of food. He lost 15 pounds of weight. His cholesterol level from 200 came down to 130. His LDL level came down to 45. I put him on a statin medication, and we did a repeat CT scan on him after 5-6 years. His calcium score had gone down, actually. He wanted me to do an angiogram, but I refused to do an angiogram on him because I knew it would look better. He has no symptoms. He's planning to climb Mount Everest. He's preparing and working on it. He exercises on a regular basis, and he sleeps well, takes his medications well. He has a good support system. So in 10 years, we have had reversal of heart disease. And I have countless patients like this. And many of my colleagues have countless patients. So if we follow these 5 principles, which include good diet, eating in moderation, eating more plant-based diet, and following it regularly, if you have a bad meal, then make sure you next 4 to 5 meals are excellent. Once in a while, we'll fail, but don't punish yourself and go to eating bad after your failure. Exercise regularly, sleep 7 to 8 hours a night, take your medications regularly, and have a good social support system. Meet your friends, talk to them, participate in their lives. You will be able to reverse heart disease. Thank you.